All right, we will call the Health Committee meeting for April the 2nd in order. And thank you for being here through all the chaos. We have 3 public hearings today, so a little rare, and space is limited, so thank you for being patient. All right. Today, you want to call first, Bill?
I'm going to call the roll.
Oh, yeah, call roll first.
Representative Lee?
Here.
Representative Lipscomb? Here. Representative Hall? Here. Representative Sorrells? Representative Mooney? Representative Warren? Representative Marcus? Here. Representative Gray? Here. Representative Rafferty? Here. Representative Paramore? Here. Representative Rigsby? Here. Representative Holt-Jones? Here. Representative DeBose? Here. Representative Shiree? Here. Representative Brinyard? First bill, Representative Standridge, House Bill 441.
Okay, kind of give you an idea what we're going to do today. We're going to let the announcers or the bill sponsors speak, talk about their bill, and obviously if you have any questions for them, let's wait till after we have the public hearing. And we have, in this particular case, we have only 2 that oppose it and have 1, 2, 3, 5 on the other side. So I'm going to pick 3 that support and allow the 2 that's here that oppose it. So that's the game rules that we're going to play by. And we will have 3 minutes per person. Michael Ann will time us, and it will be 3 minutes to the second. So, all right, Representative Sanders, Chairman.
Thank you, Mr. Chairman and members of the committee. This bill is House Bill 441, and it's about speech-language pathology assistant. And what this bill does is that it establishes an associate-level speech-language pathology assistant, which means that what would be required is an associate degree that could be obtained at our community colleges. This issue came to light. Actually, Representative Collins has worked extensively on this issue, and she brought me into this with other people, but what we found out is there's a big shortage and a need, and it came to light really in the K through 12 schools and what's going on with the issue there with their not being able to find people in this profession. And so they've had this idea and come up with this plan of being able to get the assistants, which would still have to work under a full-blown speech-language pathologist. And this would create a program in the community colleges for an associate level. And this is not a new concept. It is presently being done in 23 of the 33 regulated states. So 23 states already have this in place. And we feel like this is with the shortage and what's going on, and you'll hear a lot more from the other speakers about the specifics on that. And how they're ready to do that. But that's what the bill is planning to do.
We will start with the public hearing. Michael Ann, if you will call those people.
Rodney Green.
Thank you. My name is Rodney Green. I'm superintendent of Blount County Schools in North Alabama. I represent 8,000 students, including pre-K, and 1,000 employees there. We have 14 different schools. We have 14 pre-Ks. We also serve our 3- and 4-year-olds in speech-language services. We're currently serving 731 speech students that have a separate IEP for speech services. Greatest challenge in talking to Representative David Standridge, who is my representative. I appreciate his support, and Representative Collins, and also talking and speaking on multiple occasions with Dr. Karlowicz from Wallace State, who serves much of our county. This has been an issue for us for several years. We've been down 6 speech teachers for 3 years. This year, we're down 8. I have 5 full-time. I have 8 contracts, so that's 13. Of those 8 contracts, 4 are teletherapists, where we have to hire an aide. I have 4 aides, who go down to the classroom, pick up the child, carry the child back to a room. The therapist is on television, which meets the IEP requirement. It's not nearly as effective as face-to-face, of course. That's a situation we're dealing with, but the cost of that is also a great challenge. As we look at that cost, contracts, and there'll always be a place for contracting. I'm not speaking against our contractors. They're fantastic. I'm thankful for them. There'll always be a place for speech-language contractors. But that is $70 to $80 an hour, plus mileage, plus travel time at $70 or $80 an hour. To give you an example, since October 1 up until April, I've spent $272,000 on contract speech services. That's a 6-month period. I could hire 6 speech teachers for the whole year for about $360,000. So I'm slated right now to spend over $500,000 this year on fulfilling my IEPs for speech services. And I would just like to add, we're supplementing them. Thank you for supplementing the speech teachers across this state along with special ed. You've done some great things to help us. We're also supplementing our SLPAs at $2,000 and our SLPs at $3,000 to try to keep them from leaving the state. All in all, we don't have enough people going into this profession, and I think one of the things this associate degree would help get them started in the pipeline so they could see their way to getting their bachelor's and their way to getting their master's. And I appreciate your time. Ask you to reach out to your local superintendent.
Thank you very much.
Francis Clark.
Good morning. I am the ABESPA Vice Chair, and I'm an SLP in District 1. And ABESPA's role is to protect the consumers of Alabama, and we license the SLPs, the SLPAs, and the audiologists in the state. While I really do appreciate Mr. Green's perspective and where he's coming from, and we do realize that the SLPs in the schools absolutely are an issue, and we want to work together to find a solution for that. My concern with, or the board's concern with this House bill is that it impacts all setting where SLP services are provided. The wording is associate degree and SLP certification may be employed by the public K-12 schools of this state or in other non-educational settings. And so we have concern about the consumer safety that's involved in that. We haven't received information about the curriculum of the proposed SLPA associate level training, which we obviously want to look into as far as to see what the level of education would be in the associates versus the bachelor program. And I feel like there is a place for both possibly. A lot of states, as you said, other states have allowed SLPAs at the associate level, but they also, a lot of the states have a tiered support personnel program. And so there are certain things that an SLP with an associate degree can do, and then there are things that an SLPA with a bachelor's level can do. And so making sure that we are giving the proper training and the proper allowances to meet the needs of our residents, but also keeping everyone safe in the process. We are not aware of another state that allows associate level SLPAs to do what currently our bachelor level SLPAs can do in the state of Alabama. And so what we would also like to propose is collaboration between the different parties involved get with Department of Education, get with the school systems, get with the Commission on Higher Education to look at, and the university programs who already have the speech-language pathology programs, to see how to meet the need while we're making sure that we're protecting the residents of our state. And that's all I have. Thank you.
Very good. Thank you.
Representative Collins.
Thank you for the recognition, Mr. Chairman and committee. When this need in our schools was brought to my attention, the first thing I really did was to try to reach out to Commission on Higher Education and Jim Purcell to meet with the board, because I also know this can be done through administrative code, which is really my preference. And so I thought we had some agreement, and then it kind of backed off with the board. So I worked with Representative Standridge to see if we could get some language. I also am very concerned about quality, wanting to make sure any programs that we have are high quality and meet the standards that you need them to meet. I like the thought of a tiered program. I think that there is a good possibility we could find ways to work. We met yesterday with some of our higher education partnership, and like I mentioned, I'd worked with Commission on Higher Ed because we would like to work together. I think there are ways that we can get this done. How you would treat and use speech pathology in a K-12 type setting would probably look different than if you're in a nursing home or hospital. So working together to make this successful and to try to fill the gaps is very important. The last thing I want to say too is that every area of education right now is looking for ways to allow students to participate at an earlier age and create an interest. So if we have this in a community college or even some of our university systems that also have 2-year programs and credentials and licensing, if we can broaden this and make it available so that someone in a career tech type program in high school could see this in their health sciences, well, this is something I'm interested. This is something I'm good. If we can promote that interest earlier, I believe that we can get more people into not only a community college program, but into that bachelor's program and on into the master's program, which is what they actually have to be a speech therapist. Thank you, committee.
Thank you.
Jay Merle.
Thank you, Mr. Chairman, members of the committee. I'm Jay Merle. I am the attorney for the Speech and Hearing Association of Alabama. We have 1,000 members. They're all speech-language pathologists, speech-language pathology assistants, and audiologists who practice and reside in Alabama. You've heard the perspective of the licensing board. I want to talk to you about the perspective of the licensees, the people who actually do the work. They have 2 main concerns about this bill. Number one, as been pointed out, there are not enough speech-language pathologists in Alabama. Under current law, the assistants must work under the direction and supervision of a speech-language pathologist. Since there is a shortage of speech-language pathologists, they are already spread thin in terms of what they must do to fulfill their professional obligations and the supervision of the current number of assistants who practice in the state. If you are adding assistants to the state but lowering the educational requirements, that is going to make the problem worse, not better. The second main concern with the bill is it is just not limited to school-based assistants. It could also apply to assistants who work in nursing homes or hospitals, and that's a very different skill set, very different population than what you would be dealing with in a school situation. We are very much in support of a tiered system, something where you would not dilute or diminish the current bachelor requirement to be an assistant, but that would provide a pathway for someone with an associate's degree to fulfill a certain role, to fulfill certain functions, not all of the functions of an assistant, but some of them, and that could help take the burden off. Because at the end of the day, we don't want to diminish the good work and important work that the assistants do, at the same time maintaining their current level of education and training. Thank you.
Dr. Karowicz.
Thank you for the recognition, Mr. Chairman, and fellow members of the committee. I'm Vicki Karlowicz. I'm president of Wallace State Community College in Huntsville, Alabama. Today, we are simply asking that through HB 441, you resolve a critical workforce need by allowing a speech and language pathology assistant to be credentialed at the associate degree level. The American Speech-Language Hearing Association offers national certification of speech and language pathology assistants at the associate degree level, and their national certification examination is approved by the Council for Clinical Certification in Audiology and Speech-Language Pathology. According to Lightcast occupation data, there are 2,500 jobs for speech-language pathologists in Alabama, which has grown by 38% in recent years, further exacerbating the workforce shortage. From 2018 to 2024, the average monthly job postings for speech and language pathologists in Alabama was 94. Last year, our state's universities graduated only 165 students at the bachelor's level and only 107 at the master's level for speech and language pathology, and 40% of those were out-of-state students who are likely going to return to their home state to practice. In Region 1, where Wallace State is located, there is one university program, and it produced 15 graduates last year who were eligible to fill the 258 Region 1 job postings by 48 different employers. As you all know, Alabama is growing, but the North Alabama region is growing at an alarming rate, and the demand for speech-language pathology services is accelerating. Many regions, especially those that are in rural and underserved areas, are especially affected, and an SLP associate program would be vital to filling those workforce gaps. Wallace State's associate degree healthcare graduates provide nursing care in intensive care units, surgical units, and emergency rooms. They provide rehabilitative physical therapy to accident victims and occupational therapy to stroke victims and pediatric patients. They provide radiation therapy to cancer patients. And our associate degree respiratory therapists manage airways for premature infants in neonatal intensive care units. I am more than confident that certified graduates of an associate degree speech-language pathology assistant program will provide exceptional services and care within their scope of practice under the direction of a speech-language pathologist. I am respectfully requesting your support of HB 441 to address a critical workforce need, especially in our local education agencies. North Carolina, Tennessee, Georgia, Arkansas, West Virginia, and 25 other states do so.
Thank you. Thank you. Okay, what we will do now, if you have any questions for the sponsor, I would open up the floor. Well, just say Representative Hall.
Thank you, Dr. Karowitz. Are you indicating that this bill would be the instrument by which you would determine or have a program, an associate program, or do you presently already have the program? So you're saying we are to make the, if we make a decision to vote for this bill, we are helping you to become, to offer the program? Could you tell me,
Do you need to, no,
what is,
does she need to come to the microphone?
yes, please.
Please.
Very interesting. Okay. I find this quite interesting that what is the process presently by which you would get a new program?
Well, it
For your
really it
students.
depends on the profession. The board of BESPA is really the gatekeeper to the profession. And several years ago, BESPA raised the credential required for the profession from a baccalaureate degree to a master's degree, further exacerbating the workforce shortage that exists in the state of Alabama. So the board is the gatekeeper to the profession. So without the board's approval at this point, and we met with them last fall, we presented them information, we presented a curriculum outline, we committed to them what we would do. The board chair at that time was very promising in some. He complimented the curriculum that we had presented, and we felt that we were making some progress. But when the board changed its chair subsequent to that, we got a letter in maybe late February that they had declined our request to start a program at the associate degree level.
One more.
Yeah, I guess I've heard from the board, it appears that there has been some changes and there has not been a meeting of the minds recently.
We met with them in
anyway.
April. I mean, in October, they requested some additional information about how programs get approved, how curriculum is developed at the community college system level. We provided that information to them, and we have not heard any more from them until they declined our request in writing.
Thank you. My only concern is that we'd have to use this process for you to do what you should be done as a college or university. Thank you.
Thank you, ma'am.
Representative DuBose, I'll get to you guys in just a second.
Yes, I just have a quick question, and I'm just going to ask this to Mr. Merrill. You were the attorney there. Yeah, so you mentioned that, we have a shortage of speech-language pathologists, and that would be detrimental to adding more assistants, as if there's a correlation in the numbers there. But can a speech-language pathologist not supervise more than one assistant at a time? They can do two at a time. So, okay, so they still... Okay. Thank you.
Representative Gray.
Yeah, my question was more based on, okay, let's say if they get this associate's degree, are there any states that then require them at some point to get a bachelor's? So do you have, if any state like that where maybe they can start on associate level, but at some point, maybe 3-5 years or whatever, they have to actually get a bachelor degree at some point? Because I feel like that's kind of happy medium, because it seems like this is quality over quantity. It seems like that. It's like one group of people are basically saying that, yeah, you need these requirements to actually be an assistant, and another group that's saying the minimum is an associate's degree. But is it any model where they can start with an associate's degree and at some point, maybe not like immediately, but at some point get a bachelor's degree?
Well, I'm not sure about other states. That's a good question. We can find that out for you, Representative. But my vision would be what you're talking about, is that it would be a pipeline. And I met with Representative Collins and I met with the university, some of the representatives from the universities yesterday. And that's what we talked about as a way to make a pipeline for this that would actually help everyone, I think. And the issue, some of them talk about, they said this would work well. Most everybody has said this would work well in K through 12. And that's what we're really focusing on. They were concerned about the hospitals and nursing home settings and those type things. And I think that can be worked on easy with the bill. And because some of that has to do with reimbursement from Medicaid and Medicare, those type of requirements. And I think that could be worked on pretty easy. And we're willing to do that. We want to work with the board. We want to work with the universities, and they have said they would like to do that too. So I think that that's a good point.
Representative Shirey.
So it kind of seems like we're creating a new profession here. Will these assistants be supervised by an SLP?
Yeah, they have to be.
So if we don't have enough SLPs now, and we're going to add more, I don't see how that's going to work.
Well, you've got to start somewhere, Representative. I respect that. You've got to start somewhere, because what is happening is this shortage is getting worse, and it's getting worse quickly. And what we're trying to do is, the way that I see it is, you heard from Superintendent Green about what his situation was. And, I have personally observed some of these sessions that they have. I can't imagine how effective a televisit is with a 5-year-old that's got many problems. Okay. That's what they're having to do to meet that IEP. Now, they need a person in there with them, a trained person, even if they're working under the supervision. If he can hire a certain number in his school system as full-blown speech pathologists, then they can supervise these assistants in his system and make that work.
But only 2 of them.
Well, according to the current rules, that's right. But that's what I'm saying is they can make that work.
Yeah. And are the SLPs required to supervise these people? Because ultimately it's going to be their liability by overseeing this.
Yeah.
And if there's not enough and we give them 10 more, we can't employ them.
Well,
because there's not enough SLPs to supervise them.
Well, I don't think that, I mean, what we're trying to do is create an environment that has the professionals in it and to make that work. If they know, I mean, the people that will make the decision on hiring would know what they have to meet that requirement. I mean, so they would know that.
Representative Paramore.
Yes, you answered part of my question with working with the universities, but I'm having a difficult time, and I know we got a little bit more time before we do anything on this, but
That's right.
you know, the pathway, if I want to work in the school system and I get an associate's degree and that's what I want to do, I have no incentive to go on and getting a bachelor's degree in doing this. And if we're limited, I think we need a rule change possibly that they can oversee more than 2 if that's, you know, within the realm. But, you know, I think maybe we have some limited number of people graduating because the program is strenuous to get through, just like a lot of medical professional programs are. I don't want to, this is a bad term, but I don't want to dummy down the process of getting into the system. I mean, if I need one, or my child or my grandchild needs a speech pathologist, I want the best one. I don't want an assistant, but that's, you know, that's me. And I know you got to deal with what you got to deal with, but when working with the universities, I want to make sure that there is a pathway that we don't cut out the bachelor's degree.
No.
You know, and because you're still going to have the same number of graduates out there. Adding more assistants to it, I don't think solves the problem. It may solve the problem in the school system to have somebody there actually in person, but it doesn't fix the problem of having more pathologists and their supervision ability.
No, I agree with you on that. And that's in our meetings with the universities, that's what we're trying to come up with. And they're working on some language that will help that, because we want to create a pipeline. That's what we want to do for them to achieve that. We need to get them in the system, though, to do that. And we worked, that's the reason we had a great discussion yesterday working with the universities on that specific issue, because we do have to recognize, though, then this is not brand new. 23 other states, almost half the states have something similar to what we're proposing here. It's not a new issue. And so it's been successful. And just think about that compared to if your child that you mentioned had an issue and they got somebody on a TV and trying to work with that in speech. Think about that. So, yeah. And part of the reason is it's a strenuous program. It's a strenuous program to get that master's. That was changed from a bachelor's to a master's at some point. And it is, but the other limitation is the number of students that they take in the master's program. That is a big barrier because a lot apply and they can only take so many. They only have so many slots. And that's the reason.
Is that a national level rule? I'm sorry, Mr. Chairman. Is that a national rule to make it a master's, or was that a state? National? Okay.
All right, we have 2 more. Representative Warren and Representative Hall has another, and we're going to put a bow on this. And I would encourage, no, I'm talking about with the public hearing. But what we're going to do is I would encourage you to talk to Chairman and make sure, Standridge, that if you have any questions, get with him one-on-one, or any of these folks out here that can answer one way or the other, anything you want to do that homework between now and we will either be here next Tuesday or Wednesday for a vote. I'm not sure on that yet. Representative Warren.
Yes, I've listened to the discussions back and forth between the board and the college. Where and what role will SACS have to play with the overall approval of this?
I think that would be with somebody else. Could you answer that?
Uh-huh. Yeah, I was just making sure that this would not be finalized here. We had other steps to go beyond the state of Alabama to get this approved.
Does that answer?
Yeah.
Representative Hall?
Tell me, the colleges and universities that you met with yesterday, who were they?
Yes, with a representative from South Alabama and a representative from Jacksonville, and they brought me also information from others, Montevallo, and so there was another one, but I'm sorry. They wasn't there present with me in the meeting, but they had sent information by the representatives that were there.
There are other, okay. But I would ask that you are inclusive in using the.
They came to me, and they said that they represent a group of the universities to do that.
I just want to say I would ask that you are inclusive in looking at Alabama A&M, Alabama State, in terms of those that offer the programs.
Yes, that is very important because Alabama A&M is the university that offers program in my region. So,
just want to make sure we're.
All right, we have. Well, I'm sorry, we have a sign-up sheet. I know you came in late, but that's okay. We have this is my encouragement again to talk to them and kind of get what problems you or questions you have worked out. So that concludes this public hearing, and if y'all will, we will vote next week. So I'm not sure Tuesday or Wednesday, but if you'll exit out that door, and if our 2 pages, Grayson and Tyler will come up here, we're going to introduce you with the next group. Thank y'all. Thank you.
Media and press, you can stay. Members, House members can stay. Everybody else, please exit this out over here. Which one?
Okay, we can bring the next group in, Derek. Thank you.
445. Go ahead and find a seat, please.
I love when people think they're in charge of stuff.
Find a seat, please. Find a seat for me, please. Come seats over here. Got two over here. Got one seat, one row. I'll let you make that comment, Mark. Lieutenant Bradford. Lieutenant Bradford. Come on in.
Thank y'all. Yeah. Hey.
We get to see it? Hey, Whitt, we get to
Okay, I believe the seats are right around the corner here. Okay, thank you for, I mean, this is unusual, but we're trying to do our best to get everyone in and out. Before we start, I have our Representative Gray has 2 pages with him this week. One, okay. All right, so if you would introduce him. And I think he's back here. He's going to have to walk out.
Tyler, come out. So I have Tyler Adams paging with us this week from Park Crossing High School. Is there anything you want to say? Okay. All right.
He is getting an eyeful today. So, Representative Whitt, I think you have a page with you today.
Yes, sir, Mr. Chairman. I'm certainly proud to introduce my friend, Grayson Mitchell. Grayson is a junior at Athens High School, and today he is getting to see our government in work. So we certainly appreciate him being with us today.
Very
Thank
good.
you, Mr. Chairman.
All right, Ms. Michael Ann, if you'll call the next bill up.
House Bill 445 by Representative Whitt.
Mr. Chairman, members of the committee, certainly thank you for allowing me an opportunity to come by today to discuss something that's very, very important to me, a project and an issue that I've been working on for at least 9 months, if not longer, but it has plagued our state much longer than that. HB 445. This legislation is an effort to place guardrails on a currently unregulated, unchecked, and dangerous industry, and that is the sale of psychoactive cannabinoid products, also known as Delta 8s, 9s, infused drinks, vape products, and other smokables. These products are currently being marketed all across our state in gas stations, in retail stores, grocery stores, and even being served on tap in local bars, restaurants, and as I've mentioned, there is zero regulation or ability to stop these products from protecting our citizens and then preying on our youth. These products just put profits above anything else. Let me just quickly tell you about the bill and what it does. This bill provides for the ABC regulation of all CBD products, prohibits the sale of CBD products or these cannabinoids to anyone under the age of 21, restricts these locations that the products can be sold, prohibits the sale for on-premise consumption, no more grass in a glass or anything of that nature at our restaurants and bars. No more slushies on Interstate 65 headed to the beach. We are here to shut that down. Limit the amount of THC to a 5 milligram per serving, and that means THC-infused watered beverages, THC-infused gummies, and if you look in the bill, these gummies will be individually wrapped, and they will be in child-proof containers. Prohibits the sale of inhalable products such as vapes, flowers, or the buds that we often see in convenience stores and other places across the state that are being sold. I'll fear from my notes, I carried in a law enforcement agent to one of these individual stores. It was full of these jars, and it all looked like dope to me. And he said, I asked him what his thoughts was, and he said I would shut the whole store down. I can't tell what the potency is of these flowers, these buds, and certainly if you're driving down the interstate and you get stopped by a police officer and you've got an ashtray full of this marijuana-looking stuff, what is the stop there? Requires all manufacturers to obtain a certificate of analysis on their product from a certified lab. ABC must approve this labeling, and no more of these products disguised as suckers, airheads, Doritos, brownies, and all these other things they put this product in to sell to our kids. Products, and then this provides stiff penalties for anyone that is trying to sell these products. Why is this important? Because this must be guardrails placed on this product. Guidelines established, since many have found loopholes in the 2018 hemp bill passed by the U.S. Congress. This, unfortunately, is unintended consequences, and it is simply the Wild West. In Alabama, poison control has experienced 1,423 exposure calls since 2022. 470 last year were 76% from product ingestion. That means gummies, edibles, etc. 16% required hospitalization and were in the ICU units. In 2023, Alabama Poison Control shockingly noted to me that over 40% of these calls now, please understand this, committee. If you don't hear anything, hear this. 40% of the calls were from children over or under the age of 6 that were overdosed. Kids under 6 can't drive. Something seldom mentioned in the connection between the products and is something that I've learned in this process is the correlation of sex trafficking and human trafficking. In Michigan, the county where Flint, Michigan is, they had the largest bust that they've had in human trafficking. When they were debriefing the young ladies that were taking in, and it was 20, 25, I think, something of that nature, how were they so subdued? They were given gummies. They were given suckers that was laced with this THC and these Delta 8-9 products. It was largest at that time in the history of the state. It is past time that Alabama takes this issue up and pass substantial reform for this problem that has plagued our state, and it's only growing in size. I dare anyone in this committee or in this room that you can go to any service station within walking distance of our state house where we're at today, any convenience store, and possibly even a restaurant, and find these products. Let me give you some examples, because I'm a show and tell guy, as you've known me throughout my legislative career. I'm an evidence-based gentleman when I present you the facts. So in my process, I began looking at this, and this is a product that without doubt is being sold to our children. Now, Hulk Hogan told me as a child that I needed to do push-ups. Obviously, I didn't do many, but and vitamins and take my vitamins. And now here he is selling gummies. Now this is 100 milligram gummy with 1,000 milligrams per pack, bought legally at a convenience store. Okay. Second one. Now understand this. These are 100. Okay. 150 milligrams, 50. So half of this serving is equal to a bottle of 80% vodka. A half a serving of this product is equal, per CDC, equal to 80% proof vodka bottle. And the comment says it is a strong euphoria. Again, half of this serving size. So then I travel over to another little gas station on my way down to Montgomery to see what I may be able to find, as you know, as I've done in the past. And then I run across this iced tea lemonade, which absolutely looks delicious. It's got a frog riding a bicycle. If you drink this, you'd probably feel like a frog driving a bicycle. This is the Cycling Frog Cannabis Company from Oregon. This not only has 50 milligrams of THC, but this is 50 milligrams of CBD. Again, nowhere on the label does it say this is for anyone over 21 years of age or anything. It said, get your head in the clouds all year round with Cycling Frogs, delightfully sparkling THC iced tea lemonade. Serve ice cold and get high, and I'll leave that out. The most worrisome product that I saw was purchased in Shelby County. And now it's got a warning label on it. This is a pack of gummies. It was legally purchased. No ID was given. It was a young lady, not my daughter, but it was a young lady that was purchased this and brought it. The serving suggestion, which we know that no one looks at on the back, the serving size of this gummy is 1/16. A nibble of this gummy is 1/16. So let's read the ingredients of a 1/16 nibble off this gummy. Again, no age, no requirements. Stores, these are marked up over 200%. We have hemp-derived Delta 8, 215 milligrams, which equates, if my math was right, you're looking at 17,200 milligrams in this 10-pack, in this pack here. So that should scare you to death. It scared me to death, and I thought it was a misprint. But not only do we have Delta 8, we have THCP, 20 milligrams, Delta 9, 12 milligrams, THCA, 3 milligrams. I don't know if I should have gloves holding this. I mean, this is bad stuff, and it's being sold to our kids. We all know, I have folders full of emails from parents, law enforcement, where we've had overdoses. You know, since I've been working on this within the last week or two, we've had individuals that have been med-flighted out of high schools because they've taken this. When you go to school and you buy a gummy, you have absolutely no idea what you're getting. This is not tested, and some of the tests that I have learned from my friends with Aaliyah, as they've tested them, has had as high as 24 THC, milligrams of THC, as I understand. So anyway, those are there. So those are my show and tell examples. 2024, the age group that most detected with the overdoses was ages 2 to 15, with 161 cases of overdoses in Alabama, and that was through October. 16 to age of 24 was the next with 40 cases. 22 overdoses in 2024 were under the age of 2. Someone that takes these cannot drive and operate a car. When you go to a convenience store and you see these ready-to-drinks, I'm sorry, they're not ready-to-drinks. Do not get them. But these are ready to drink because these are on ice, okay? These were. But do not get those confused with the other drinks. But these are on ice. They're ready to be sold, and they're sold in bars across the state. In Birmingham, you can go online. I'm driving home from Montgomery, look up at a nice sign, billboard sign. It says, hey, buy your products here. We deliver. I said, you got to be kidding me. Rick's, let's call him. Chairman Reynolds and I called, and I said, hey, I'm having a party over here in Birmingham. Would you like to come over and bring us some of this stuff? Well, absolutely. We thought you'd never ask. And I said, well, how much is it? They said, go online and shop for it. And then put in your address, and we'll deliver it, and we'll all have a good time tonight. Well, thank you. And I hung up. We are coming for the bad actors that puts profit in the safety of our children. Convenience stores need to stick to selling gas and sodas, and they are not our local pharmacy stores. We are going to regulate these products. And like I said, I had a folder of emails, law enforcement calls, etc., and many news articles across the state. So these products we know plague our society. And I thank you for your time and listening to me on my House bill, trying to regulate. And this is HB 445. Thank you.
All right, thank you. We have several that signed up, but what we're doing is choosing 5 on each side. On these, we'll have a 2-minute limit. And if you've been in here before, Michael Ann will have a clock on you, and she will cut you off in the middle of a sentence. So we have another one after this, so we're going to be here a while. But if you would call the first one, please, speaker.
Christine Carr.
Christine Carr. Okay.
Thank you, Mr. Chairman. I appreciate it. The piece of material that's being sent out is just from Miss Alabama Teen 2024, Allie Mims. She hoped to be here today to talk with you, but she has a lot of tests and projects to get finished, so that's what takes precedent. But she did want to share that this is a crisis, and we all see it as a public health crisis, but in our schools, students everywhere in Alabama cannot finish a day at school without being hassled by THC gummies, vapes, and drugs as early as 5th and 4th grade. It's happening in the bathrooms and in the classrooms in our Alabama schools. Now, my name's Christine Carr. I'm a nurse anesthetist with over 30 years of patient care. I've given lots of guest lectures in the biochemical field and specialize in anesthesia, trauma, intensive care, and also do a lot of drug prevention and medical advising for various groups. I want to say thank you, Andy Whitt, for taking this on. This is extremely important, and I am about 75% on the support column. I think a lot of what Representative Whitt is doing is fantastic in tackling this problem. There are a few key elements, and I would love for you to ask me questions if possible. I sent all of you an email this morning at 9 a.m. if you want to look up for the details. But there are key parts to this is that we have to deal with potency and dosage much more succinctly. 5 milligrams is a great start, but it can still be 100% THC if you're not looking out for potency. Legal hemp is less than 0.3% THC at dry harvest weight. This is part of this crazy loophole. Thank you, Congress, for giving us this problem. But we're not testing for THC levels at end product. If we want to continue to call this hemp, it should still be at 0.3% THC or less end product. I ask you to make an amendment to make sure we're not just testing at dry weight, we're testing at end product usage. Thank you, Representative Whitt, for bringing up the issue of certificate of analysis. I've spoken also with the Department of Ag, and we need to have better testing and analysis. Thank you.
Carmelo Parcelletti.
Thank you. Yeah, just put them there and go ahead. All right, your time, we'll wait. Now it starts.
All right. While we strongly oppose the misuse products by minors, we believe that the criminal penalty should be enforced for anyone who sells to those under 21. Selling to minors is absolutely unacceptable, and those responsible should face severe consequences. However, punishing adults who choose to use these products legally and responsibly should not be the answer. This is pushed under the false pretense of protecting children, yet this data simply does not support the hysteria. In 2023, Alabama Poison Control reported 235 Delta 8 cases, and these cases represent just 0.018% of Alabama's 1.3 million residents under 21. Most importantly, no deaths have occurred. Cannabinoids like Delta 8, CBD, CBG are non-lethal, non-addictive, and federally legal. Mr. Whitt says plagued, but again, 0 deaths. We trust adults to make informed choices between alcohol and tobacco, substances that are proven to cause millions of deaths annually. Why can't we trust them to choose between alcohol and safer non-lethal hemp-derived cannabinoids? This unfairly targets federally legal products, punishes licensed hemp growers like myself and processors and retailers who have invested in Alabama's future, costing jobs and reducing economic impact. The arbitrary THC cap of 5 milligrams per serving for hemp-derived products, that's akin to telling someone they can have a small beer but no higher alcohol options, even if they prefer it. Just like some people prefer low-alcohol beer or wine for a lighter experience, others may prefer stronger options like vodka or grain alcohol. Why should we treat hemp-derived products any differently when they're safer? Adults should have the freedom to choose what's right for them, whether it's a low-dose edible or a high-strength option, without arbitrary limits that don't make sense. There's no scientific or health-based reason to limit patients' choices to just one-size-fits-all dosage, and it highlights the disconnect between the constituents, the industry, and the representatives who are supposed to serve them. These kinds of arbitrary rules only serve to restrict access, stifle innovation, and confuse consumers who are seeking relief, not more red tape. We don't put profits over people. We have a cancer program and a Parkinson's program where we give products directly to these folks at no cost to them, and they have reported better standards of life. This would impact those Alabamians. It's disheartening that while neighboring Mississippi has a thriving medical cannabis program and running, Alabama still hasn't issued a single license.
Thank you.
Thank you. Becky Garrettson.
Good morning. I'm Becky Garrettson, the Executive Director for Eagle Forum of Alabama, and I want to begin by thanking Representative Whitt for sponsoring this bill and for the efforts to regulate consumable hemp products in Alabama. The intent of this legislation is commendable as it seeks to address important issues like consumer safety, proper labeling, age restrictions. But however, we support the goals of HB 445. We do have concerns about the workability of this. First off, and most importantly, this bill allows for the sale of psychoactive cannabinoids. Scientifically speaking, all psychoactive cannabinoids are marijuana. Non-psychoactive cannabinoids are hemp. So I picked up these hemp products on my way to the State House. Again, labeling who knows what's in there. These are hemp products, but they have been chemically altered and they contain psychoactive cannabinoids. I asked the cashier if these products would get me high, and I quote, she said, yes, they will definitely get you high. On page 3, lines 76 through 78, it's acknowledged that psychoactive cannabinoids are being sold in Alabama, yet the bill does not ban them. Psychoactive cannabinoids are in essence recreational marijuana, which is supposed to be illegal in Alabama. So I'm just going to make it short and say that the bill language is opening up Alabama to full recreational marijuana for adults or codifying what we're already seeing. Now, the bottom line is these products need to be banned. Hemp products that are not psychoactive are fine, but let's ban the others. And Representative Whitt, I do really appreciate our talks offline. Hope you've been able to review and maybe implement some of our suggestions to make the bill stronger and help us move closer to more full support. But I thank all of you for really paying attention to this very important issue. Thank you.
Thank you.
Molly Cole.
Chair and members of the committee, my name is Molly Cole, and I represent the Alabama Hemp and Vape Association. Thank you for the opportunity to speak today. We stand in opposition to HB 445, not because we oppose regulation, but because we oppose rushed legislation that fails to consider its full impact. This session alone, we've seen at least 7 hemp-related bills introduced, and that tells us that this is a complex issue, yet instead of a coordinated approach, we are seeing reactionary proposals that could devastate businesses and eliminate over 10,000 jobs in Alabama. Let me be clear, we fully support keeping children safe, but the goal that is best achieved through responsible regulation, clear labeling, product testing, and 21 age restrictions. just like we would require for alcohol. Meanwhile, pure grain alcohol remains readily available on store shelves. If the goal is consistency in public safety, then we must apply the same regulatory logic across industries. This bill would also push consumers across state lines, benefiting neighboring economies while crippling Alabama businesses. The enforcement challenges alone would give us a pause. Who will oversee this? At what cost? These questions remain unanswered, yet we are being asked to advance this bill anyway. Another major argument for stricter regulation is impaired driving, but I urge the committee to examine how this data is being collected. THC can remain in a person's system for up to 120 days. Meanwhile, a positive test does not confirm impairment. Using incomplete science as a justification for sweeping regulations is not only unfair, but also deeply flawed. So instead of rushing HB 445, I urge you to support a study commission. Bring together legislators, regulators, industry leaders, and public health experts to craft long-term, evidence-based policy. Other states have done this successfully, and Alabama can too. So let's get this right. I urge you to oppose HB 445 in its current form, and let's take a more thoughtful approach. Thank you.
Thank you.
Terry Long.
Hi. I'm very nervous. This is my first time being here.
That's
so
okay.
I apologize. Thank you, Representative Whitt, for your dedication and work on this bill. There are aspects of, I have to put my glasses on. While there are aspects of your bill that I support, like removing these dangerous synthetic drugs from our gas stations, and I agree with other aspects, there are several aspects that I oppose and believe that more work needs to be done on this bill to help save lives. My family, I'm going to skip that part. We have been harmed by these products. And so my loved one was a victim of these drugs that are readily available, beautifully packaged, and enticing to our children and teens and young adults. These products are dangerous for anyone under the age of 25, specifically. My loved one will never be the same. He will be medicated on pharmaceutical drugs for the rest of his life, for my loved one's life. My loved one never had a mental disorder, a physical ailment, was physically fit, and an academic scholar. Just one high from these synthetic THC drugs can cause brain damage, psychosis, and lead and open the door to schizophrenia. That's what's scary about these drugs. Go look at Canada if you want to look at some data on THC. They just released this year a study where they looked at prior legalization, medical legalization. Their schizophrenia cases have tripled.
Thank you very much. We're sorry for what you had to go through.
Whitt Garner.
Representatives, thank you for your time to speak today. I'm Lou Garner, COO and founder of Easy Hemp Co., a hemp beverage company operating legally under the current law. We serve thousands of Alabamians who are concerned about the proposed legislation limiting our products to 21 and up establishments. While we fully support keeping these products out of minors' hands, we also believe responsible regulation can coexist with our
there you go. Or raise it up.
With our continued business operations. Our agreements and solutions. Strict age verification. We support tough ID checks and propose a 3 strikes rule. Any business caught selling to minors loses its license. Transparency and testing. We back comprehensive testing and clear labeling for consumer safety. Consistency and safety is paramount. THC limits. We agree on reasonable THC content caps to promote responsible consumption. Additionally, ban on synthetics. We fully support banning synthetic cannabinoids like Delta-8. Who we are. Our products are in over 500 locations statewide, including Piggly Wiggly's, the Orion Amphitheater, Grand Bohemian Hotel of Mountain Brook, and various James Beard award-winning restaurants. further proving their appeal to discerning adults in respected venues. Our best customers, women 35 to 45, soccer moms, looking for a responsible alternative to alcohol. Our beverages contain only real fruit, mineral water, and hemp extract, no added sugar, artificial sweeteners, colors, or fake flavors. And furthermore, it's brewed by Straight to Ale in Huntsville, a local product. The effects of our low-dose products are comparable to a small glass of wine or domestic beer, mild and enjoyable, not excessive. Limiting sales to 21 and up establishments would slash our distribution and sales by 95%, threatening jobs in an industry-leading local business like ours. Our ask, we respectfully request an amendment allowing us to continue selling our products to adults 21 and older in grocery stores, restaurants, country clubs, and venues where our customers are already currently responsibly enjoying them.
Time.
Thank you for your time.
Thank you.
Oh, no. Lieutenant Bradford.
Thank you for having me today. I'm going to try to make it simple. I'm on the law enforcement side. My name is Lieutenant Bradford. I'm with Trussville Police Department. Last year, we saw a severe increase of persons either overdosing or purchasing these products inside of the vape stores. We've made several arrests, several overdoses, and so we started investigating and started looking at the products that they're purchasing. We ourselves, my undercover narcotics officers, legally purchased out of 9 vape stores in our city, 12 products. Each product was sent to a DEA certified lab in Georgia, SJ Lab and Analytics. Not one of those products was under the 0.3% that the law allows for hemp. Anything above 0.3% is simple, it's marijuana. So we're legally allowing these people to sell marijuana. So out of all the stores we had, from 1% all the way up to 10.71% THC is what's being sold. And that's what these kids are buying, these adults are buying, overdosing, we're sending them to the hospital, yet there's no regulatory board, there's nobody overseeing this. And I'm thankful for Representative Whitt to try to get the ABC board to take control of this, because our city is at the verge of taking control of it ourselves if we can't get anything going from the state. It's killing our kids. It's damaging our community. It's sending the wrong message. And basically, we're allowing people to sell marijuana. If an officer pulls over somebody who leaves a vape store and he's got the flower bud sitting in his ashtray, he's going to jail for possession of marijuana. But all it has to be is a green leafy-like substance. That's the arrestable, that's the probable cause to arrest somebody, okay? So in this situation, we're allowing these people to sell products that are not even labeled. I'll give you a great example.
Thank you very much for your service as well.
Mitch Hungerpiller.
Mr. Chairman, distinguished representatives and lawmakers, thank you for hearing us. My name is Mitch Hungerpiller. I'm a CPA, certified public accountant here in Alabama since 1995. I'm an entrepreneur and a businessman. I take this issue very seriously. I am invested in the low-dose, microdosed hemp products that, as Luke mentioned, are responsibly manufactured, responsibly tested, and responsibly delivered through distributors that are licensed by the Alcoholic Beverage Control Board. What we would like to ask and respectfully request is that this committee amend the proposed bill to allow us to continue selling our products responsibly to adults age 21 and to restaurants, country clubs, and venues. We even sell to a funeral home. Literally a funeral home, a florist. These are responsible venues. They have adults that use these. This is like a glass of champagne. It is like a light wine, 5 milligrams. Our product is 3 milligrams. Every pharmaceutical has milligram doses. What the problem is are the out-of-control packaging and high-dose products. Most of the states that have done regulation, there's about 8 to 10 that have done it in this class that is 2018 Farm Bill compliant, have put requirements for the labels, requirements for the certificates of analysis for the labs, and good manufacturing practices. That's what we ask. There are hundreds, thousands of customers in Alabama that do not want to drink alcohol. They have problems.
Thank you, sir.
Chris Einebet.
Hey, Mr. Chairman, committee members, thank you for having me. My name is Chris Inhabitant. I'm the director of the State Bureau of Investigations at ALEA. So thank you for having me. Talked to Representative Whitt, and he wanted us to kind of bring forth maybe some issues that we've seen while we're looking into these complaints that we get from all across the state regarding these THC products. And we're hopeful that the legislature will take steps to control these THC products through effective legislation. So I can tell you, much like the Lieutenant mentioned earlier, for the last 26 years, I've been in law enforcement. And the enforcement of THC in Alabama was pretty straightforward. If a product contained THC, it was marijuana. Well, all that changed in 2018 with the U.S. Congress's hemp bill. So the percentage, the 0.3% of THC was basically deemed legal. Products that contained at least that much or less were legal. Meanwhile, over the last few years, these various products, which do look and smell most of the time like traditional marijuana, they popped up everywhere, all over the state, and it's prompted complaints and issues, not only from citizens, but other law enforcement agents saying, hey, Aaliyah, what are you doing about it? Well, it's kind of muddied the water of what we could or couldn't do, because it's not very, one, it's not regulating, two, the law's not very plain of what we could do with it. So we've been looking at different scenarios, different avenues of how to tackle this. So historically, when we've submitted items of evidence for testing, it just comes back whether it contains THC or not. So that wasn't good enough, right, to satisfy the hemp bill. So we had to find a more qualitative analysis. So we talked to Tennessee Bureau of Investigations. They found a presumptive field testing piece of equipment. We purchased one. And so we went out and made some buys of these products, much like the representative did. And we got their publicly available certificate of analysis. Well, from that certificate of analysis compared to the testing that we've done, they're not congruent. So from the test that we've done with this device, it is way higher. The THC, total THC content is way higher than the 0.3%, 0.3% that's allowed.
Greg Davis.
Thank you, sir. Thank you for your service.
Thank you, Mr. Chairman. I represent churches all over the state. Everywhere I go, meeting with our churches, some 3,500 of them, everywhere I go, I get asked about this issue. We can talk about all the issues that go on here that I'm here and get to follow and track, and always get the question, what about those products being sold in the convenience store around here? It's affecting our kids and adults in a major way. So I appreciate Representative Whitt doing the hard work and standing out on this issue, because no one really has done it until this year. So we're very appreciative for that. And we share the same urgency on this issue. I know we all do. And it can be complicated. There's a lot of 0.3s, 0.5s, all this going around. It can be complicated. I think we can simplify, though, by skipping the guardrails, and let's just go to a stop sign on these products. Texas is doing this. These are synthetic intoxicants, and they're dangerous, even if you're 21 and above. There is a danger there. And if it's 21 and above, teenagers are still going to get these products in their hands if they're sold in a retail situation. They're going to get them one way or another. We know that. So let's just put a stop to it. And I hate to see us become dependent on tax revenue from these harmful products. So I know there's a plan for revenue toward enforcement, also for treatment, for help for victims, if we went that route. And I just, the people I represent, they do the funerals, and they get the calls to go to the hospitals with families like hers. So it's urgent, it's serious, and they see it. And so while I appreciate all the efforts and something's got to be done, I say a stop sign is what we need to do. We need to ban these products in the state of Alabama like other states are doing. Thank you.
Thanks, sir. That it? All right, that concludes. Representative Whitt, if you would come back up and keep in mind, guys, we've got another one, so let's kind of keep it limited. Are there any questions? Representative Gray?
So I commend you for this bill, but I wonder what's the difference between this and alcohol? I mean, essentially, tobacco, alcohol is bad for you, to some degree as well, but people consume it. So the age requirement, some of the restrictions make sense, but it seems like we're just moving too fast on some of these restrictions, where we understand that we don't want a 6-year-old or anyone of that nature to be able to consume these products, but
okay, so
someone 21 or older.
I'd be glad to answer that. I just showed you in my presentation there with my show and tell, if you took half of the gummy that I presented to you, that was a bottle of 80% vodka. That's the difference. If you put half a gummy in your mouth, that is almost like a full bottle of vodka. That is the difference.
So compared to alcohol, what is the death ratio? Like
I don't have the death ratio of that. Again, this has only been in operation, Representative Gray, that we've had to do as it's an expanding industry over the last 6 years since 2018. So what I'm trying to do is put up guardrails, but I'll be more than happy to share the emails and the voicemails that I've got, again, from concerned parents that have had individuals.
I would love to see the numbers, as far as the deaths compared to alcohol and this product. And, because sometimes we can be a little hasty with things. I'm all for regulations. I'm all for 21 and older and all those things. But, some of the things that you're trying to do, I'm not.
That sounds like you're in favor of my bill, and I appreciate it.
I'm not totally in favor. Some parts of it, right?
Okay, Representative Shiree, and then Representative DuBose.
Representative Whitt, this product is basically recreational marijuana. Is that correct?
Yeah, in my opinion, it is, yes.
So we have not passed legislation to legalize marijuana, so this is an end run around the intent of our current laws. This industry, last session, lobbied for medical marijuana, stating that this is not a gateway to recreational marijuana, yet here we are selling it. Is that your...
They're selling it. That's correct.
Thank you for bringing this bill.
Representative DuBose.
Thank you, Representative Whitt, for bringing this bill, and I've learned so much listening here to you today. The number of children under 6 and under 2 that were harmed by this drug is really alarming.
Yeah, and I just do want to clarify this. Here's the public health report, and I'll be more than happy to share it with the committee. These are real numbers.
Yeah, and so, but what's concerning to me is these children will still have. Those products were purchased by an adult and fed to the children, given to the children, or given to the victim. So, adults would still be able to purchase a version of this product, but they'd have to go to the
21 and over store. That's correct.
Yeah. So adults could still continue to purchase them, and minors under that age would still continue to be harmed if adult purchase them, just like they have in the past.
Well, I mean, yeah, that's no different if you could get mom's Oxycontin bills.
Yeah. So as long as it's available,
so anyway, that's it. So that's the way I look at it. But understand, I am putting a cap of 5 milligrams on the product. So and they're individually wrapped.
Mm-hmm. So that's what I'm trying to say. And you're saying 5 milligrams, but right now we're saying 0.3 is the legal marijuana limit. So we're going from 0.3 to 5.
No, we're not going up at all. This is the 5 milligram.
But I mean, you're limiting it at 5 when 0.3 is the legal level of marijuana. So that's
correct.
That's big. Okay, and then
again, not of our doing.
Okay, so this is just what I'm trying to understand. We understand that there is harm to these psychoactive That's what we call that portion of it, the portion of the THC. So why are we selling these at all anywhere and not just limiting to hemp only? Why are we selling?
Why are we selling?
Yeah, why
this?
would we want to sell
Okay.
that, even with a 5 milligram level?
I don't want to sell any of it.
Yeah.
Okay. That would be all right with me. But the problem is with the federal law as it stands, and as I understand it, that this is the minimum that we have. I work with the Department of Health. I work with ALEA and also the ABC. And this is the bill that we came up with, that there is.
So we can't just put a ban to the.
I just talked with a sponsor in the Senate earlier this morning, and they told me their bill wasn't going anywhere.
Representative Hall.
I want to say first, thank you. Over the years, I've carried a bill just dealing with drug paraphernalia that is sold at our convenience stores. I was amazed at the pushback.
Yeah.
I mean, the people come out of the woodwork on the issue, and they say it's either the fine is too high. There are a number of things, and much of this that you've talked about deals with paraphernalia that's presented, and many of these service stations are within walking distance of our schools. And so I want to say thank you. Certainly, I have not gone through the bill to the degree that I totally understand that process. But the other thing that I want to also mention is TH8, Delta 8.
Delta 8. No.
Every year there's a new name, a new product. So we will continue to come back and make a science
This
change.
bill will cover that moving forward.
All right, thank you.
Representative Mooney.
Thank you, Mr. Chairman. I think it goes without saying everyone knows where my position is about any of these things. Ban them, flat out ban them. But I do want to point out an experience of working with the head of our commander of our multi-jurisdictional task force in Shelby County in relation to drugs and things of that nature, Clay Hammock. He's the chief deputy in our county. I reached out to him to just find out what a trusted person in my county thought about it who served in law enforcement. And the thing that I guess I would like to share with everybody is a statement that he gave me just this morning. He said, "This is nothing more than profit at the expense of public health and safety, and plainly put, getting high." Clearly, from what you have said, and I commend you for bringing the bill, but clearly from what you've said, adults are getting high on this. Adults drive cars. Adults driving cars have wrecks. Cars having wrecks kill children. Children who get a hold of things are damaged in the way this lady's family was damaged. We're facing a situation, I can't but help but ask the question, why would we not just ban the whole thing? And I guess that's my question to you, and in a way it's a plea, that we have so many people being damaged who are adults. DUIs, about 50% of them we heard this week were the result of non-alcoholic DUIs. So we know where those are coming from. So I just share it in that way.
Representative Rigsby, and this will wind up the public hearing.
Thank you, Mr. Chairman. Thank you, Representative Whitt, for bringing this. Just 2 points. As a pharmacist, I start looking at some of these terminologies and things like the synthetic THC products and cannabinoids. Those are Schedule I narcotics. People don't realize that. And so pharmacies aren't allowed to sell those things. There is a loophole because of the Farm Bill where pharmacies can sell CBD hemp-derived products that contain less than 0.3%. But we have to have certified analysis of those products. If we get inspected by the state board, we have to have those on file to prove what we're selling meets these requirements. My question, though, second part of that question is, when you define your beverage or edible 5 milligrams of total THC, can that come from hemp and synthetic, or is that only naturally derived hemp?
I'll need to defer to my health experts, wherever they were at in the room. Yeah, I think it said synthetic as
So
well.
it can be
just
either,
like you did.
it can be either or?
Either or.
Okay, thank you.
Yeah, that, if I'm not mistaken on that,
Okay.
it had that. Two things before I leave, and Mr. Chairman, I want you to, committee members, listen to what I heard today. Money and health. Money and health. And I think that's where we're at with this bill, and that's what's held these bills up in the past, and I think it's time that we do this. ABC has the ability to take on the additional responsibility. They'll be visiting the 21 and older stores. And then with that, I'll be glad to answer any questions later.
Well, we're going to wind it down on this one. Thank everyone that could. I'm sorry, we should have known that before. I mean, if y'all would have let us know, we'd have made sure. Well, okay, but not today. All right, everyone, as you exit out the door, to go out this door, the others will come in.
Exit to the left over here, please.
Oh, I got to stand up.
Thank you.
You already done it?
Have you already saved the seat?
That's right.
Are you okay? You good? You good? Hey, you only need one more? Yeah, I'm gonna say these two. Yeah, okay. All right. Okay, cool. So.
You need you to go ahead and find a seat, please. Go ahead and find a seat.
Hey, man. Good to see you again, y'all. Yeah. Well, you can sit. Y'all can sit in the middle.
Are you saying you don't know this bill well enough yet that you know?
Well, no. Come on out. No, sir. Hey, I've been around you and them so much. I want you to sit.
No, you didn't ask me to sit here.
No, hey, Dane, I just meant right there.
Well, you think by now you know it all. You wouldn't leave you to it.
That's right. Yeah, I can. That's fine.